Hi, my name is Felipe Betances. This is the Hematologic System discussion. The following is the scenario for the Hematologic System discussion. A 73 years old female presents to the emergency room from the home with complaints of generalized fatigue and occasional dizziness on standing from sitting for 2 weeks that is worsening and a decreased appetite. Patient has a history of a chronic back pain which she treats with over-the-counter pain medications and has been experiencing some nausea the past week, but has not vomited. Patient's labs revealed hemoglobin 9.1, hematocrit 32%, and MCV in 80. Well, in this scenario, it makes me think that there is an iron deficiency anemia due to blood loss, probably due to a peptic ulcer. Anemia in the elderly is a common disease that is associated with increased mortality and hospitalization rates. According to Amano et al. 2021, the management of anemia in elderly is critical, and appropriate assessment and consultation with hematologists are essential. Upper gastrointestinal bleeding is of particular importance in the elderly because it is an event that can quickly endanger life. In the elderly, the high incidence of associated osteoarticular and cardiovascular disease also affects the intake of medications, such as non-steroidal anti-inflammatory drugs and aspirin. The frequent toxic habits in the elderly, such as the consumption of alcohol, coffee, and tobacco, constitute factors that exert an ulcerogenic effect on the mucosa of the upper digestive tract. The most common cause of bleeding is the gastroduodenal ulcer. What causes iron deficiency anemia? There are many things that can lead to a lack of iron in the body. In men and postmenopausal women, the most common cause is bleeding in the stomach and intestines. This can be caused by a stomach ulcer, stomach cancer, bowel cancer, or by taking non-steroidal anti-inflammatory drugs, as I said before. If the ulcer bleeding is light, you may not see blood in your vomit or stool. However, you can develop anemia. Anemia occurs when too few red blood cells or is there not enough hemoglobin in the blood. According to Heroes et al. 2018, extensive care should be taken to avoid ulcerative intestinal hemorrhage to elderly patients receiving multiple doses of non-steroidal anti-inflammatory drugs. According to the World Health Organization 2018, the prevalence of anemia is 17% in elderly people, 40% in hospitalized patients, and 12% in the community. The prevalence of anemia increases with age. Patient education. Iron deficiency anemia has a good prognosis when treated properly with iron supplementation. Here we have some recommendations for patients taking iron supplements. Take iron on an empty stomach 1 hour before or 2 hours after a meal. Start with only 1 tablet per day for a few days, then increase to 2 tablets per day, then 3 tablets per day. Increase the intake of vitamin C to enhance iron absorption. Eat foods high in fiber to minimize problems with constipation. And remember that stools will become dark in color. And last but not least, we have the reference just in case you want to know more about this topic.